Hello and welcome back. So this is part 3 of our lecture on twin pregnancy. We will discuss the different treatment options for this condition, twin to twin transfusion syndrome. See, many years ago, there was just the one of the options was just don't do anything, expectant management, right? Don't do anything. But the problem is, majority of the babies they will pass away. Later on, some techniques were developed. One of them was amnioreduction. So, amnioreduction basically means that remove extra water from around the baby who is polyhydramnios, who is the receiver, who is the recipient twin, right? But the problem is the underlying condition is not addressed, right? So even if you remove extra water from the baby with polyhydramnios, it can reaccumulate. And of course, there are chances of introducing infection and preterm labor. Then there was one more technique which includes septostomy. So that means just make a hole using a fetoscope, like just make a hole in the septum in the between the two amniotic sacs. But again, the problem is okay for the time being it can help. More fluid can move from this baby with polyhydramnios to the one with oligohydramnios, but the underlying condition is not addressed, and this there may be resealing of this membrane. Okay, so again, this is not effective. Then the next option is selective feticide. Just inject something into the baby, like just or inject or not exactly inject, but just make a decision to kill one baby. Okay, so how is that performed? See, if the placenta is not shared, then one of the option is introducing potassium chloride into the heart of the baby who is not doing well. For example, if one baby has Down syndrome and the other is doing well, yes, one of the options may be selective feticide, right? Or even if it's, say, for example, an octuplet pregnancy, like if there are eight babies, right, by accident, and to make to enable the other babies to develop normally, some of the babies, especially those who are weak or who are growth restricted or who have some anomalies, those babies can be selectively killed. Okay, so that's called selective feticide. But the problem is if it's one placenta, and if we inject potassium chloride into the heart of, for example, one baby, it can go through the placenta into other babies, right? So that's not an option in monochorionic twins. Then what can be the option? So cord coagulation, coagulate the cord of the baby who is not doing well, on if we don't want that baby. Okay, so in placenta monochorionic twins, if we have to do selective feticide, it's just cord coagulation. Okay, that's an option. But for twin to twin transfusion syndrome, the more recent technique and the preferred one is something which is called fetoscopic laser ablation of vascular anastomosis. Remember, we said that in the placenta there are arteriovenous anastomosis, so just coagulate them. Okay, because that's the main problem, right? It's because of the unidirectional blood flow. Okay, so but even after treatment, so what can happen? Laser ablation is actually the definitive treatment for severe twin to twin transfusion syndrome. Between 16 to in 10 teachers, it's 26 weeks is written. So and after twin to twin, after 26 weeks, these babies may need to be delivered, right? Especially when dexamethasone has been given, at least their lungs have been matured. So depending on what is the Doppler situation, are they developing hydrops? So the plan for delivery may be made. Now there is one more complication which is called twin arterial anemia polycythemia sequence. It's actually a type of twin to twin transfusion syndrome in the sense that it's the there are vascular anastomosis present. Okay, so what happens in this situation is actually there is no polyhydramnios or oligohydramnios. In fact, instead there is one baby is anemic and the other one is polycythemic. Okay, so what happens to the baby who has anemia, right? So whenever there is severe anemia, what happens? Heart, there may be heart failure because the main function of heart is to pump blood. And what is the main function of blood? It is to provide oxygenation to the tissues. So if there is low hemoglobin, because hemoglobin carries oxygen, right? So if there is low hemoglobin, if there is anemia, the heart just tries to supply oxygen, right? And in that effort, it increases heart rate. So it has to work more. Okay. So, but ultimately, there comes a time when it fails, right? So that's the problem for the anemic baby. Now, and whenever there is heart failure, the baby can develop hydrops. Okay. Now, the what happens to the baby who has polycythemia? That's again not good, because when there is a lot of hemoglobin, right, the viscosity of the blood that's increased, so that means there are more chances of having thrombosis. The hematocrit is increased, viscosity is increased, there will be thrombosis. Okay, so both of these babies, they are in poor condition. Now, the third condition, that's called twin reverse arterial perfusion syndrome, or TRAP, or acardic twin. Here, basically, what happens is that these babies do not have large arterial when anastomosis. Instead, they have very few and small arteriovenous anastomosis. Okay, so in simple terms, what happens is these babies have one baby is completely dependent on the other for its blood supply. Okay, so the baby who is dependent on the other one, that's kind of a parasite. Okay, so the other baby who is supplying blood to the underdeveloped fetus, the heart has to work harder. Okay, so the cardiac system of this apparently normal twin, it does the work of supplying blood for both twins. Okay, so the twin supplying the blood is known as the pump twin, and it may develop normally. Okay, like it's a full baby. Okay, but the other one who is dependent, usually it's just kind of it's not a fully developed baby. Okay, so it may be just it's called an acardic baby, ANCAF usually. Okay. So there are some yeah, we talked about conjoined twins. So these twins can be joined together at various parts, right? At various parts of the body. So some of them, whenever we talk about conjoined twins, the term is used as pagus. Okay. So they can be, for example, pyopagus, they can be craniopagus, for example, right? They can be thoracopagus, right? Depending on where they are attached. But you do not need to remember all of these terms. Just remember the pagus word. Twin is inside him. So initially, this person was, when he was conceived, it was a twin pregnancy. But then his twin sibling, it was inside his abdomen. Okay, so it was dead actually. It was